everyone, it's Dr. Courtney at Impact Chiropractic in Fort Collins, Colorado, and today we are going to be talking about foam rolling. This is something that a lot of patients ask us about, and we just want to make sure that you have the resources available so that you can start to do this at home properly. So foam rolling is really awesome. It is going to help release the muscles, so myofascial release. However, I would not use it instead of chiropractic and massage therapy. I would just use it as an addition for something that you can do at home just to really help those muscles after a workout, if you're running, really just any time that you need a little extra release in through there. So these are what those foam rollers look like. This is going to be a larger one, preferably the size that I like to use, but there are also smaller ones that you can also get. And then there's ones that have bumps, so intensity can change depending on the level that you want and the release that you're looking for. So these are the ones that we have in our office, so I'm going to show you today how to do a few of my favorite foam rolling exercises. So we'll actually start with IT band, and this is a really common area, so that's going to go from that hip to the knee and gets really tight and contracted on people that are running, for example. It can also be a common reason that people may experience things like knee pain if that is pulling really tight. So the way that you're going to want to do this is you're going to lay your foam roller flat, and you are going to actually go ahead and place your hand on the other side of that roller, and you are going to lay on the side that you are wanting to roll out. Now, with that bottom leg, you're actually going to straighten it out, place foot on the floor there, and you'll take that other leg and cross it over. Now, I like to use my hands to really help and guide me so that I can move forward and backwards to really find the spot that needs to be rolled out more. Really important thing though, I always like to mention, is you do not want to cross over a joint. So specifically with this one, you don't want to go over the hip or past the knee. And so again, placing those hands. Now to make this more intense, you can actually lift that foot off the ground, and I'll show you an even harder variation as well as we start to get into it. So like I said, you're going to be rolling back and forth. You will find and notice those areas that feel pretty sensitive to you. Sometimes you need to go a little bit more back, so rolling that leg up or rolling that knee kind of down towards the ground to find the area that is best for you. And then you're just gonna kind of roll. When you get to a spot, dig in a little bit deeper. Again, you can have that leg lifted or you can keep it down on the floor. Now to make it even harder, you can actually lift both legs up. And again, you're going to use your body to move back and forth, finding those areas that feel a little bit more irritated, okay? So you're going to want to make sure you do this on both sides. Next exercise is going to be for your piriformis muscle and your glute medius. So these are really common when people experience things like sciatica, that numbness, tingling, or radiating down the leg. So now what you're going to do is you are going to move that foam roller up so it's more on that tush area. You're gonna take your leg opposite of the one that you are trying to roll out and cross it over. And you're gonna make sure that you are at about a 45-degree angle on that foam roller. Again, using that hand to help him through there. And then really pushing into those areas. You'll feel again when you get to that spot, okay? Same thing, make sure you repeat that on the other side. Now, another thing I always like to help foam roll as well is for my paraspinal muscles. Those are the muscles that are running along my spine. So I like to sit evenly with my tush on that foam roller, placing my arms behind me and rolling down through my spine there. Once I get to about mid-back, I'm gonna take my arms and I'm gonna cross them and roll out. You can get in the trap area, and those rhomboids. You do wanna make sure though that you're not crossing into the neck, okay? So those are a few of my favorite foam rolling exercises. If y'all have any questions, make sure you come in and ask those questions, and we can figure out how to make sure that you're getting the best out of your chiropractic care.